Welcome to Eye Care Central. In this video, we will discuss the anatomy of the lacrimal gland. We will discuss the location and the structure of the gland, the histology of the gland, its blood supply, its nerve supply, including the Lacrimation Reflex Arc and Gustatory Lacrimation. We will also discuss the embryological development of the gland and also about the accessory lacrimal glands. The lacrimal gland is located in the superolateral part of the orbit, just above the lateral angle of the lids. So here we can trace the lateral part of the superior orbital margin, and in this area the lacrimal gland is located. This is the right orbit and this is the frontal bone. The frontal bone forms a part of the roof of the orbit. The part of the frontal bone that forms the roof of the orbit is known as the orbital plate of the frontal bone. There is a shallow depression located here. That shallow depression on the orbital surface of frontal bone is known as the lacrimal fossa. The lacrimal gland is located in this lacrimal fossa. It is also known as the fossa for the lacrimal gland. There is another lacrimal fossa that is present on the surface of the skull that lies along the medial wall of the orbit. Do not confuse this one with the other lacrimal fossa where the lacrimal sac is located. That is known as the fossa for the lacrimal sac, while this is the fossa for the lacrimal gland. Lacrimal gland is a paired gland, which means that one gland is present in each eye. Lacrimal gland is not a palpable gland. You cannot feel it from the outside on palpation. It is a pinkish grey structure. It is an almond-shaped gland. It measures 20 mm by 12 mm. 20 mm is the length and 12 mm is the breadth. It is made up of small lobules which are separated by connective tissue septae. It lacks a true capsule. The lacrimal gland is divided into two unequal parts by the tendon of the levator palpebrae superioris muscle. The larger part is known as the orbital lobe, which occupies the fossa for the lacrimal gland. The thickness of the orbital lobe is 5 mm. The smaller part is known as the palpebral lobe of the lacrimal gland, and it is located beneath the tendon of the levator muscle, that is near the superior fornix. It is 3 mm thick. If you retract the eyelid, you can see the palpebral part of the lacrimal gland. Tears produced by these lobes are secreted into ducts. About 2 to 6 ducts arise from the orbital lobe, and then they pass through the palpebral lobe, where they join with the ducts arising from the palpebral lobe to form about 6 to 12 secretory ducts that finally empty into the supralateral conjunctival fornix. Since the final secretory ducts, all of them exit from the palpebral lobe, any damage or disease of the palpebral lobe can decrease the tear secretion from the gland. That is why lacrimal gland biopsies are always done from the orbital lobe and not from the palpebral lobe. Histology. The lacrimal gland is made up of multiple small lobules. It is an exocrine gland. Now, what is the difference between an endocrine gland and an exocrine gland? Exocrine glands pour their secretions into ducts, and then these secretions are transported to the target organ via these ducts. Endocrine glands do not have any ducts. They pour their secretions directly into the bloodstream. Now, each of these lobules contain many acini. So, the lacrimal gland is made up of many ducts or tubules and acini, which make it a tubuloacinous gland. Let's understand this in detail with the help of diagrams. The lacrimal gland is made up of two lobes, which in turn are made up of multiple small lobules. In this diagram, you can see 3 lobules. Each lobule contains many acini. These light pink outpouchings are the acini. This is the magnified view of an acinus. Now, what exactly is an acinus? Acini refer to a cluster of cells that resemble the shape of a berry. So you can see here that the arrangement of cells in an acinus is similar to the structure of a berry. Now these acini are lined with columnar cells that are secretory in nature. They produce serous secretions and pour them into a central lumen. Some of these acini are surrounded by a row of myoepithelial cells that help in the contraction of these acini and help them in releasing secretory granules into the central lumen. The central lumens of these units converge to form intralobular ducts. The epithelium lining these ducts is cuboidal epithelium and it is non-secretory. These intralobular ducts join to form interlobular ducts, which then drain into approximately 8 to 10 excretory ducts that pour their secretions into the supralateral fornix. And when we blink, the fluid gets distributed over the ocular surface as the tear film. The tear film has 3 layers. From the outside to the inside, they are the lipid layer, the aqueous layer and the mucus layer. Lacrimal glands contribute to the middle layer or the aqueous layer of the tear film. We will discuss the physiology of tear production and the composition of tears and tear film in another video. In this one, we will stick with just the anatomy. So besides acini and ducts, some other cells are also found in the lacrimal gland. These are the myoepithelial cells, the fibroblasts, mast cells, B and T cells, and plasma cells. Accessory lacrimal glands are glands of Cross and glands of Wolfring. In this diagram, you can see the cornea. This is the upper eyelid and this is the superior conjunctival fornix. Glands of Krauss are located in the conjunctival fornices. There are about 20 to 40 glands of Krauss in the superior conjunctival fornix and about 10 in the inferior conjunctival fornix. Glands of Wolfring are present along the upper border of superior tarsal plate and the lower border of inferior tarsal plate. Few rudimentary accessory lacrimal glands are also found in the caruncle and the plica semilunaris. Accessory lacrimal glands account for approximately 10% of total lacrimal secretion. It is widely believed that accessory lacrimal glands contribute to basal tear secretion and the main lacrimal gland is responsible for reflex tear secretion. Blood supply of the lacrimal gland. The main artery supplying the lacrimal gland is the lacrimal artery, which is derived from the ophthalmic artery, which in turn is a branch of the internal carotid artery. Occasionally, it also gets supply from a branch of the middle meningeal artery and also from a branch of the infraorbital artery. Venous drainage is via the lacrimal vein, which drains into the superior ophthalmic vein that eventually empties into the cavernous sinus. Lymphatic drainage is to the superficial parotid lymph nodes, which empty into the deep cervical lymph nodes. Nerve supply of the lacrimal gland. So we will talk about the parasympathetic innervation to the lacrimal gland, sympathetic innervation and general sensory innervation. General sensory innervation is the simplest of them all. Sensations arising from the lacrimal gland are carried by the lacrimal nerve, which is a branch of the ophthalmic division or the first division of the trigeminal nerve. Parasympathetic innervation. The function of parasympathetic innervation is to stimulate secretion from the lacrimal gland. So this pathway is quite complex and I have tried to simplify it as much as I could. So let's begin. The efferent pathway starts at the superior salivatory nucleus of the facial nerve. To understand that, we need to start from the basics. We all know that the brainstem has 3 parts. From top to the bottom, they are the midbrain, pons and the medulla oblongata. We will concentrate on the pons. Pons contains the nuclei of 4 cranial nerves, the 5th nerve or the trigeminal nerve, the 6th nerve or the abducent nerve, the 7th nerve or the facial nerve, and the 8th cranial nerve, that is the vestibulocochlear nerve. I have not drawn the 8th nerve nucleus in this diagram. The facial nerve is a mixed nerve. It has a motor component, a sensory component, and a parasympathetic component. The motor component supplies the muscles of the face that control facial expressions. The sensory component carries sensations from the anterior 2/3 of the tongue and from the skin of the external ear. Parasympathetic component carries secretomotor fibers to the lacrimal gland and the salivary glands, which are the submandibular glands and the sublingual glands. So the motor fibers of the facial nerve arise from its motor nucleus located in the pons. This green nucleus is the motor nucleus of the facial nerve. The sensory fibers that supply the tongue and the external ear arise from the nucleus of tractus solitarius and the main sensory nucleus of trigeminal nerve located in the pons. The red nucleus here is the nucleus of tractus solitarius, and the light grey elongation here is the main sensory nucleus of the trigeminal nerve. These two nuclei carry sensations from the tongue and the external ear. The parasympathetic fibers that supply the lacrimal gland and the salivary glands arise from the superior salivatory nucleus located in the pons. The upper part of the superior salivatory nucleus is where the preganglionic fibers to the lacrimal gland emerge, and lower part of superior salivatory nucleus is where the preganglionic fibers supplying the salivary glands emerge. The upper part of superior salivatory nucleus is also known as the lacrimatory nucleus. So I repeat, the motor fibers of facial nerve arise from the motor nucleus. The sensory fibers carried by the facial nerve arise from the tractus solitarius and the main sensory nucleus of the trigeminal nerve, and the fibers that are of concern to us, that is the parasympathetic fibers, arise from the superior salivatory nucleus. Facial nerve emerges from the pons as two roots. One is a motor root and the other root is known as the nervus intermedius. So let's see what nervus intermedius is. So the motor nerve arising from the motor nucleus, which you can see as the green line here, it loops around the abducent nucleus and emerges from the brainstem at the junction of the pons and medulla. While these three roots that contain the sensory fibers and the parasympathetic fibers, they emerge together as the nervus intermedius. So this nervus intermedius is also known as the intermediate nerve or the sensory root of the facial nerve, but that is not exactly true, because besides sensory fibers, it also carries parasympathetic motor fibers arising from the superior salivatory nucleus. So upon reaching the facial canal, which is located inside the internal acoustic meatus of the temporal bone, the motor root of the facial nerve and the nervus intermedius, they join together to form a single trunk. At the facial canal, the facial nerve forms the geniculate ganglion. The preganglionic parasympathetic fibers, they do not synapse at this ganglion. So from the geniculate ganglion, the greater petrosal nerve arises that carries these preganglionic parasympathetic fibers on their way to the lacrimal gland. The other fibers of the facial nerve that we talked about, that is the preganglionic parasympathetic fibers to the salivary gland, the motor fibers, the sensory fibers, they continue along their course as mixed facial nerve, and that is not of our concern now. The greater petrosal nerve, as I told you, arises immediately distal to the geniculate ganglion within the facial canal. Along its course, the deep petrosal nerve joins the greater petrosal nerve, and together they form the nerve of the pterygoid canal. The nerve of pterygoid canal passes through the pterygoid canal to enter the pterygopalatine fossa, which contains the pterygopalatine ganglion. The pterygopalatine ganglion is also known as the sphenopalatine ganglion. So it is at the pterygopalatine ganglion that the preganglionic parasympathetic fibers to the lacrimal gland synapse. Postganglionic parasympathetic secretomotor fibers emerge from the pterygopalatine ganglion, and then they pass via the zygomatic branch of the maxillary nerve, which is the second division of the trigeminal nerve. You can see the trigeminal nerve here that divides into three branches. Maxillary nerve is the second branch of the trigeminal nerve, and zygomatic nerve is a branch of the maxillary nerve. So the zygomatic branch further divides into the zygomaticofacial and the zygomaticotemporal branches. This zygomaticotemporal branch anastomoses with the lacrimal nerve, and parasympathetic fibers are carried to the lacrimal gland by this lacrimal nerve, and tear secretion is stimulated. So this lacrimal nerve is a branch of the first division of trigeminal nerve, that is the ophthalmic nerve. You can see that in the diagram here. So this entire route from the superior salivatory nucleus to the lacrimal gland is the efferent pathway of the lacrimal reflex arc. The goal of this reflex is to wash out anything that might be causing ocular irritation. Stimulation of cornea and conjunctiva activate this reflex pathway, and the afferent limb is via the ophthalmic division of the trigeminal nerve or the fifth cranial nerve. So we will repeat the efferent pathway of the lacrimation reflex arc. The preganglionic parasympathetic fibers emerge from the superior salivatory nucleus located in the pons. They emerge out of the brainstem as the nervus intermedius. Then they enter the geniculate ganglion. From the geniculate ganglion, they are carried by the greater petrosal nerve. The greater petrosal nerve meets the deep petrosal nerve to form the nerve to pterygoid canal. From the nerve to pterygoid canal, the fibers reach the pterygopalatine ganglion. They synapse at the pterygopalatine ganglion. Postganglionic parasympathetic fibers emerge from the pterygopalatine ganglion, and they are carried by the zygomatic branch of the maxillary nerve. From the zygomatic branch of the maxillary nerve, they enter the zygomaticotemporal branch of the zygomatic nerve, and from the zygomaticotemporal branch, they reach the lacrimal nerve, which finally innervate the lacrimal gland, and tears are secreted by the gland. Sympathetic innervation. Sympathetic fibers are vasomotor. They regulate the blood flow through the lacrimal gland. Sympathetic fibers emerge from the superior cervical ganglion located in the thoracic region. These fibers are postganglionic fibers because they have already synapsed in the superior cervical ganglion. From the superior cervical ganglion, these fibers are carried by the internal carotid plexus, and from then they go to the deep petrosal nerve. Now we learned previously that the deep petrosal nerve joins the greater petrosal nerve to form the nerve of the pterygoid canal. So these postganglionic sympathetic fibers join the preganglionic parasympathetic fibers that were coming from the geniculate ganglion, and together both of them follow the same route to supply the lacrimal gland via the zygomatic nerve, and then the zygomaticotemporal nerve, and then the lacrimal nerve. Crocodile tears or gustatory lacrimation or BOGORAD syndrome. This condition was first described in the year 1926 by the Russian neuropathologist F.A. BOGORAD. Crocodile tears refers to the production of tears in response to the taste or the smell of food. So in a normal situation, we salivate in response to the sensations of taste or smell. But in gustatory lacrimation, the patient does not salivate. Instead, tears come out of his eye, and that is why it is called gustatory lacrimation. Gustatory means the sense of taste, and lacrimation means the flow of tears. So what is the etiology of gustatory lacrimation? It is seen during the phase of recovery in patients with Bell's palsy or in patients with traumatic disruption of the facial nerve. Pathophysiology. So what causes gustatory lacrimation? We need to go back to the parasympathetic component of the facial nerve. We learned that the nervous intermedius contains parasympathetic fibers arising from the superior salivatory nucleus for both the salivary glands as well as the lacrimal gland. Then at the geniculate ganglion, the secretomotor fibers to the lacrimal gland separate and continue along with the greater petrosal nerve, while the secretomotor fibers to the salivary glands continue with the main trunk of the facial nerve. In the case of Bell's palsy or traumatic injury to facial nerve, during the process of regeneration, sometimes the fibers that were supposed to reach the salivary glands, they are deviated from the geniculate ganglion and they go up the greater petrosal nerve instead to reach the lacrimal gland. So there is a misdirection of nerve fibers. They were supposed to go along the mixed facial nerve, but instead of going that route, they go along the greater petrosal nerve, and we know that the secretomotor fibers carried by the greater petrosal nerve ultimately reach the lacrimal nerve to innervate the lacrimal gland. So in this case, the fibers that were supposed to reach the salivary glands are now innervating the lacrimal gland. So the result is that any stimulus such as the smell or the taste of food, instead of causing salivation, it excites the lacrimal gland to produce ipsilateral tearing. Our last topic is the embryological development of the lacrimal gland. The glandular part of the lacrimal gland, that is the acini and the ducts, are of ectodermal origin, while the myoepithelial cells and the connective fibrous tissue, they are of mesodermal origin. The lacrimal gland begins development at 6th to 7th week of gestation as multiple solid epidermal buds arise from the ectoderm of the supralateral conjunctival fornix. So in this diagram, this pink bar represents the ectoderm of the supralateral conjunctival fornix, and this elevation is the bud that arises from it. These red dots represent the mesoderm around the epidermal buds. Mesenchymal condensation around these buds forms the parenchyma of the lacrimal gland. By 3rd month, the central cells vacuolate and lumina appears. So the lacrimal gland starts functioning at 4 to 6 weeks after birth. That is why newborns don't produce any tears. Full differentiation of the gland occurs by 3 to 4 years of age. So this was all for this lecture. I hope I was able to clear your doubts regarding the anatomy of the lacrimal gland and most importantly its nerve supply. In the coming weeks, I will be posting more videos on the anatomy and physiology of the lacrimal apparatus. Do share your feedback about this video in the comment section below. Please like and share this video with your friends and colleagues if you found it useful. And please subscribe to my channel to support free education. Thank you very much.